Simulab designs, manufactures, and sells award-winning procedure trainers for medical training and for medical device manufacturers to demonstrate their products. Founded in 1994, our headquarters, manufacturing, and customer care team are located in Seattle, Washington. Simulab holds 4 U.S. patents for technology associated with our products and has 12 patents pending. Along with our proven simulators, these patents have made us an internationally recognized leader in soft tissue simulation. As simulation becomes a more widely accepted, growing part of the medical education community, it is our goal at Simulab to provide realistic, portable, and affordable solutions for medical training. In this DVD, we will introduce to you the TraumaMan system. Since his debut in 2001, he has both won the approval of the leading surgical societies and become the most widely used surgical simulator in the world. Each year, over 20,000 medical professionals are trained using the TraumaMan system, and that number just keeps growing. On behalf of our entire team here at Simulab, we are proud to introduce to you TraumaMan, and we would like to thank you for taking your time to learn more about him.
Meet TraumaMan. He was created to meet the needs of advanced trauma surgical skills courses and now has been integrated into a wide variety of curricula that use the system for one or more of their procedures. This trainer, which utilizes patented technology, trains health professionals on life-saving surgical procedures, including cricothyrotomy, chest tube insertion, pericardiocentesis, diagnostic peritoneal lavage, and intravenous cut-down. The TraumaMan system is a simulated human torso with a complete airway system powered by a ventilator. He has 4 anatomically correct surgical zones and an ankle base for IV cut-down. The system is designed with replaceable tissue sets that allow each student a first cut experience. The tissues come pre-filled with simulated blood that bleed when cut, enhancing the simulator's realism. TraumaMan, which incorporates patented technology, offers a widely accepted and highly accredited training tool for surgical education programs. TraumaMan is an anatomically correct human simulator that has all the pertinent landmarks for locating each procedure. There is no translation required from animal anatomy to human anatomy, and all organs required for each procedure are included. TraumaMan is realistic. The body form skin and replaceable tissue sets have the highest fidelity touch and dissection of any simulated tissue available today. The replaceable tissue sets provide each student with a first cut experience. Tissue sets are filled with simulated blood and bleed when they are cut. TraumaMan also comes with a ventilator that provides an airway response in the pleural cavity, lungs, and trachea. TraumaMan is the most flexible training platform available for advanced trauma training. The system allows for the instructor to train in the proper ABC order, which cannot be done with an animal. Plus, the instructor has the ability to train just one procedure without the cost of a full animal. The system is easily set up in any type of facility, such as a training room, a hotel meeting room, or in the field. And TraumaMan never dies. He will continue to bleed and breathe for each and every student. The TraumaMan system is also set up to be a convenient training solution to manage. The system is mobile and self-contained in an airline-approved wheeled suitcase. It is easy to set up and break down after each course, and it has straightforward maintenance requirements that are outlined both in this DVD and the accompanying user's guide. There is also a simple ordering process in place for replaceable tissue sets that requires no additional purchase orders. The replaceable tissue sets are always in stock and will ship within 72 hours. Most importantly, the TraumaMan system is affordable. Simulab has set up various pricing plans that allow course providers to rent, lease, or purchase the TraumaMan system. The cost for these plans are favorable to what it would cost to use an animal or a cadaver lab. The procedures that can be performed on the TraumaMan system include the cricothyrotomy, chest tube insertion, pericardiocentesis, diagnostic peritoneal lavage, and the IV cut-down. Here is an overview of each procedure and what to expect from the TraumaMan system. Please note this DVD is for product demonstration only and in no way represents medical training. The first procedure is the cricothyrotomy. Begin by locating the thyroid and cricoid cartilage, which can be palpated through the neck tissue. The system is designed for either needle or surgical cricothyrotomy. Similar to a real procedure, when the cricothyroid membrane is cut, there will be an audible pop, and there will be a rush of air. For increased realism, a drop of red concentrate can be placed on the lubricated cricothyroid membrane before the procedure. This will provide a minimal blood effect when the student surgically dissects the tissue layers. Once the procedure is completed, there should be breathing through the tracheostomy tube, and liquid may be heard or seen gurgling in the tube. The cricothyroid membrane is designed for surgical or needle dissection, not a blunt dissection, and the membrane must be replaced after each surgical dissection procedure. For the second student, replace the cricothyroid membrane and then adjust the replaceable neck tissue by simply moving the neck tissue slightly higher up on the model so an uncut area is over the incision site. The next procedure is the chest tube insertion. TraumaMan is designed to allow for the chest tube insertion into the 4th and 5th intercostal space on both sides of the torso, allowing 4 students to complete the procedure on each tissue. It will take a significant amount of force to enter the pleural cavity, and a very familiar popping sound can be heard when the parietal pleura is penetrated. When a finger is inserted into the cavity, the inflation and deflation of the delicate lung tissue can be felt. Once the tube is inserted into the correct position, there will be airflow at the distal end of the tube. The skin is designed to feel like live tissue when sutured, allowing the student to suture the tube into place. The pericardiocentesis is the next procedure. The pericardial sac is pre-filled with pericardial fluid and is in the correct anatomical position with respect to the ribs and the xiphoid process. Once the student has withdrawn fluid, be sure to return the fluid to the simulator. This procedure can be performed between 50 to 100 times before needing to refill the pericardial sac. The next procedure is the diagnostic peritoneal lavage. The system is designed to allow instructors to teach both open and closed techniques. A DPL sample is provided for the instructor to show students a broader dissection that will provide a better understanding of the simulated tissue layers. The abdominal tissue includes skin, subcutaneous fat, fascia, preperitoneal fat, and peritoneum. TraumaMan subcutaneous fat tissue can be blunt dissected through the midline fascia. The abdominal tissue set is designed for 2 open procedures. The abdominal reservoir can be filled with clear or red-colored fluid. The system is designed for infusion and removal of lavage fluids. The final procedure is the IV cut-down. For this procedure, begin by locating the medial malleolus and tibia bone. The greater saphenous vein and saphenous nerve are anatomically positioned, allowing the student to cannulate the vein as they would on a human patient. The vein is pre-filled with simulated blood to give the student a realistic experience during the catheterization process. The tissue is designed to feel very realistic during suturing at the completion of the exercise. Each tissue set should be used for 2 student procedures, and then it must be replaced with a new ankle tissue set. The replaceable tissue sets allow multiple students to use each tissue, and yet provide each student with a first cut experience. All tissues allow for 2 students, except the chest, which allows 2 student procedures per side for a total of 4. The tissue sets are delivered in a convenient, vacuum-sealed package that ensures freshness of the tissue and preserves the fluid levels. The TraumaMan system is available for rent, lease, or purchase to meet your facility's budgeting requirements. Simulab offers a variety of rental and leasing options to accommodate course providers who prefer to manage the system on a course-by-course basis or through an annual or multiple-year agreement. Simulab also has a purchase program available. We hope this overview of the TraumaMan system gives you a better understanding of this unique system and all it has to offer educational programs. If you would like any additional information, please contact Simulab's customer care team